Hello and welcome to Elvil & Associates and the Law Offices of Gary Greenwald's 2020 Client Event On-Demand Video Presentations. We're pleased you've joined us today. We're privileged to have Ms. Ellen Platt with us today, founder and owner of the Option Group, LLC. She is a Certified Rehabilitation Counselor, Certified Care Manager, and a Certified Aging Life Care Manager with a span of over 30 years providing care management, advocacy, placement, and case coordination services to those with catastrophic injury, chronic diseases and disabilities, as well as those that are aging and navigating longevity. Ellen has presented at our client care program quarterly education events in the past and will be sharing her knowledge with us in an ELVA webinar series presentation this fall as well. Under her leadership, the Option Group has been a trailblazer in the senior industry by collaborating with other leaders to provide high-quality, high-skilled services that help families navigate very complex situations. The Option Group will be rolling out several large innovative programs over the next couple of years to address the needs of its clients and allow them to live the richest, most functional lives possible, keeping safety, comfort, and dignity in mind. Today, we have Ellen discussing COVID-19 and mental health, a very timely and important topic as we all navigate through this pandemic together. So with that being said, Ellen, I will turn it over to you, and thank you for being with us today.
Thank you, Jeff, and thank you for having us today. This is a great opportunity for us to have some conversations. I'm sure that the audience has been experiencing a lot of different feelings and scenarios and situations, and I wanted to just share some insights and some experiences that we have at the Option Group. What we do at the Option Group is we provide private case management and advocacy. So we're helping families navigate longevity, whatever that means for them. It may be somebody that is declining cognitively or physically just because of age, or it may be because they're experiencing some crisis, whether it's a physical catastrophic injury or a chronic disease like multiple sclerosis, or going through cancer treatment. But we also are working with people who have mental health issues, and the families are looking for resources and supports during that time. So we'll do medical care coordination, navigate resources, do a lot of education with families and help them understand the disease process or services that might be available to help support them in their time of need. So we're going to be talking about a lot of that today, and I really am excited to have this opportunity, so thank you. We're going to be talking a little bit about, just the introduction about care management. We're going to talk about insights and experiences that we may have. We're going to talk about trends that we're seeing with COVID-19 and really dive into the mind-body connection and how that affects us with stress and anxiety. And then how do we manage that in a healthy way? And then we will talk about, we'll end with some mental health resources in this area that will be able to support families as they go forward. So the 8 core areas of expertise of care management are shown on the screen here, and these are the different areas to look at. So care managers are at the center of this circle with the client and the family, helping them with decision, support, and implementation. So the different areas that we're looking at are financial, making sure that a care plan is sustainable. We look at housing. We look at the family supports and psychosocial supports that somebody may have to support them through their journey. Local resources that might be available for them, and advocacy for a person who may need somebody to step up for them and make sure that they're getting the services they need and helping them with their difficult situations. We look at legal aspects, making sure that maybe somebody has a person in place in case they are no longer able to make decisions, whether it's cognitively or physically issues that way, or it could be because of a mental health condition that is precluding them from making decisions that are in their best interest. And a lot of our focus here today is going to be on crisis intervention. When there's been a crisis, we're going to talk about ways to hopefully avert that crisis. And then we're going to be talking about health and disability and how chronic health conditions may impact their ability to function independently. So this is prior to COVID. It's kind of a pie chart of time on average spent in a typical workday for somebody who's between the age of 25 to 54 with children. So this is how an average person would be spending their time. And this has probably changed over the last couple of years. We may be sleeping a little bit less. We may be doing a little bit less in the way of leisure and sports because we're caring for others and trying to do a lot more work. Some people are working 2 jobs and 3 jobs to kind of have that balance in their finances. I want everybody to think about what their top 3 unmet needs may be. Just give a thought for a minute to what that might be. And research has shown that that is finding time for themselves, that may be leisure activities or just ability to take care of themselves, but also coping with emotional stressors and finding a balance between work and family. And I'm sure prior to COVID that many people were here watching this today were experiencing those same kinds of things. This is probably still true with COVID, but it may be magnified a bit more. So what we're going to do is try to find ways that we can take care of ourselves, cope in a healthy way with the stressors, and then trying to find that balance, because the balance with work and family was always difficult, but there's an added layer with this pandemic that makes it even more challenging. So in addition to the usual balancing our work, balancing our kids, maybe aging parents and family, taking care of our household activities and requirements and obligations, and also our leisure activities. So in addition to those things that we have always tried to find a balance with, we now also have a lot of other things that we're dealing with. One is now we're working at home. Do we have the space to do that? Do we have Wi-Fi that we can do that? How can we create more of a normal schedule so that we can do that? We also, many people are dealing with school at home, and they may have multiple kids. They may have other demands for the kids to be able to zoom in with school, so the Wi-Fi may be stretched a little bit. Kids may also be going out to school some days and staying home other days, so it's finding a balance with that changing schedule and finding the support that they need so that the kids can get their homework done and meet their deadlines while the parents have their own deadlines working at home. So it becomes a real challenge. We also are looking at aging family and neighbors and friends that we need to help support and protect. And there may be added complications of aging family who have health conditions where we want to make sure that we're protecting them from the virus or exposure to the virus. And then we've all heard the news of people who are unemployed and companies that are going bankrupt, which creates job insecurity and financial insecurity to these families that are already stretched pretty thin. So this just adds extra to our to-do list and adds extra worries on a day-to-day basis that we need to take into consideration and figure out how we can support and navigate that. We may be getting mixed messages. One day you hear that masks are good, the next day you hear that they aren't. There was a lot of mixed messages. Some of it is misinformation and miscommunication, but a lot of it is, as we go, experts are learning more and more about COVID and how it affects us and the trajectory of the disease. So we need to make sure that we're staying up on the latest and getting guidance from experts and CDC and people who are infectious disease specialists, and making sure that we're knowing what is the truth, connecting into our government and their regulations, whether it's local, state or county governments, and what their requirements are in terms of masks and PPE and being able to visit into facilities or going to restaurants. So just making sure we're up on the latest information and making sure that we're educated on the latest expertise. Some people have serious health concerns. So not only all of us being concerned about being exposed to COVID and how we can minimize our exposure as much as possible, some people may have serious health concerns that may preclude them, that if they would get COVID, they may have a more serious progression of the disease. And we want to minimize that exposure wherever possible. We're also going to be seeing people who have other health concerns and they're not receiving treatment because they're afraid to go to the hospital, they're afraid to seek medical condition. Luckily, we have telehealth and other ways that we can stay connected with our primary care physicians and seek treatment and not put it off or delay care that might be necessary. But these are things that we need to keep in mind. We also have our own questions about our own health and about the trajectory of this COVID and what's going to be happening. But we also have issues of how can we help explain this to our kids? How do we explain something that we may not fully understand on our own? And again, is just educating yourself, listening to the guidance from the experts, and not going into a lot of detail with the kids. It's explaining it calmly, how you understand it to be, reassuring children that you're going to be there and available for them, and reassuring them that if we have questions as a family, we're going to try to find the right information to either help us or educate us so that we can be empowered with information to make educated decisions when we're in a position where we need to make some decisions. And all of this is going to increase stress and anxiety. So we need to make sure that we're taking care of ourselves and minimizing that stress and anxiety and finding outlets for it. So what we may be feeling is a lot of uncertainty. We may be feeling loss of control because there's a lot of things that are out of our control. We're going to be seeing that people are isolated, and that's a problem, and feelings of danger. People are constantly bombarded with information from the news, whether it's related to COVID or not. We're hearing about the wildfires, we're hearing about the hurricanes, we're hearing about the political unrest, and that it makes us all have this underlying feeling of danger, and which makes us anxious. And with the isolation, I wanted to note that there have been some studies that say that isolation on an ongoing basis, that feel of loneliness and isolation, is the equivalent of smoking 17 cigarettes a day. So we want to think about that it really has a significant impact on our health. So these are other things that we're hearing, the political unrest and all the demonstrations that we were seeing early on. We see the riots, and we're hearing all about the election and how that's uncertain for everybody. And everybody seems to be operating on the defense. A lot of what we're seeing is very polarizing events. We're seeing a lot of my way or the highway attitude, and it doesn't allow for a lot of collaboration. And we need to make sure that we're having open minds and having conversations that are really productive to help us get through this together. We also now have supply chain interruptions, things that you used to be able to easily get at the grocery store or at the store. We're seeing empty shelves or the inability to just buy what you typically need. There's food insecurity. So people who may be really worried about how they're going to feed their family this week or next week and not really sure what's going to happen, either because of supply chain interruptions, it may be because of their economical situation. And it's just, again, another source of stress and worry for a lot of families. And as we have winter coming on, we're going to see more isolation. The nights are going to be getting longer, the days are going to be getting shorter, so we're going to have that darkness. We're going to have the inability to get out and do things outdoors as much, and that's been a way that a lot of people have been able to get together, is by meeting people outdoors. But if it gets too cold or the weather makes it difficult, people are going to be getting more isolated, and that's going to become even more true if we have a second wave of COVID. So that all leads to stress again. So we're going to talk about that. The statistic that we're seeing is that 70% of Americans say that the US economy is a source of stress since COVID. And that's compared to 46% who said that in 2019. just a year ago. What we're seeing in terms of the levels of stress is very similar to what we were seeing in 2008 during the Great Recession. And we're seeing that 67% of Americans say that the government's response to this crisis is a source of stress, feeling like it's not quite enough, or that we need more information or more support, or we've seen some governmental programs to support small businesses or to support restaurants or help just the everyday person that needs help with unemployment or needs help with financial support in their day-to-day activities. More than 1/3 of Americans have displayed clinical signs of anxiety, depression, or both since the coronavirus pandemic began. Trends that we are seeing. The aging population, actually only 15% of them are saying that they have an increase in stress since coronavirus. And what's happening is that they have life experiences such as the Great Depression, wars, political unrest. And so they have life experience and resilience and coping strategy that they seem to be taking this more in stride, even though they are a vulnerable population and we do need to minimize their exposure to coronavirus. They're able to take their situation in stride, and it's just another blip on their screen that they're going to get through. What we're seeing is the very high distress group is actually the age group of 18 to 29, because that group prior to the pandemic had very high levels of stress and anxiety. And so they had difficulty with coping with stress and anxiety even prior to the pandemic, but now they don't have the life experience or the life perspective to put it into perspective like our aging population is. So it's become a very difficult situation for people in that age group. And the other thing we need to keep in mind that the long-term effects of this type of collective disaster is going to really, we're going to see effects over a decade. It has a ripple effect that we're going to be seeing for many years in terms of the economy, in terms of mental health, and in terms of resources available for people to be able to move forward in a positive way. Statistics are showing that we're seeing increases in domestic violence, substance abuse, whether it's drug abuse or alcohol abuse. And we're seeing that people who have sought treatment in the past and been sober are now relapsing at alarming rates. Anxiety and stress level are increased for all ages. Suicide rates are increasing. We're also seeing aging population that some of them are just saying, you know what, I'm done, and they're checking out. And we're seeing that the death toll is increased because of that as well. Psychiatric rates are increasing, and especially with the population that had pre-existing psychiatric issues. And we're seeing a lot more marital issues and bankruptcy because of the economic uncertainty. So we're going to look at the mind-body stress connections. Studies have consistently shown that stress and anxiety at increased levels chronically over a period of time shows altered general health, altered immune function, sleep deprivation. We're seeing telomeres that are shorter, and that's in their DNA, where telomeres increase our rate of aging and decrease our life expectancy. And so with stress and anxiety, they tend to shorten the telomeres, which affect our physical ability to age. We also are seeing increased emergency room or physician visits, increased blood pressure, and increased cortisol and other hormones that are related to stress and anxiety. Our ancestors had the fight or flight ability. So when our hormones increased because of stress and anxiety, it served us very well as our ancestors when they needed to fight or they needed to flee from a situation that put them in danger. We are not exactly fighting or fleeing from COVID. So what happens is these hormones build up in our body and we have no way to get rid of them, or we need to find ways to in a healthy way to get rid of them. And we're going to talk about ways to do that, because if those hormones just sit there and increase all these things that we see on the screen, it's going to be affecting our health in a negative way. So many health problems are caused or exacerbated by stress, and these are the kinds of things that people may be seeing that they perhaps didn't see before. A lot of people were seeing it before because of the rates of anxiety and stress already, but these may be increasing for some people. And these are the 10 signs of stress that we're seeing. So taking this into consideration, you may be seeing some of these things that you did not before, and think about it. It may be a response to underlying anxiety and stress, and we need to figure out ways to cope with it in a healthy way. These are other symptoms. And again, things that we want to look at and find ways to cope with it. So the unhealthy coping strategies are withdrawing from families and friends and activities. And even though we have to do that in a way that's going to keep us safe from exposure to COVID-19, we do need to find ways to stay connected, maybe different ways. Some people just quote unquote zone out for hours, just watching TV or looking on the computer or doing social media. Some of it is important to keep us connected. Some of it may be just a way to avoid issues or crisis or concerns about our health or well-being. Procrastinating, just not getting around to things. Some of that may be related to depression, just cannot find the energy to do that. But we don't want to just keep procrastinating on things that need to get done, especially those things that are for our well-being. Taking stress out on others. Some people start having angry outbursts or they lash out, and that's where we're seeing a lot of domestic violence, because people are finding it difficult to cope with what they're experiencing. Coping strategies, there may be some that temporarily reduce stress, but cause more damage in the long run. And that may be smoking, that may be overeating or undereating, that may be drinking alcohol, sleeping too much, not sleeping enough, and using medication, whether it's prescribed medication or illegal medications to be able to relax. And that may have a temporary effect, but in the long term, it really can be damaging to our health. You may see it manifesting in the workplace. People may not be meeting deadlines. They may not be caring for themselves. So you may see a coworker who seems kind of disheveled when you're on Zoom or not showing up to meetings. They may not be reliable. They may be withdrawn. It may affect relationships both at work and home. And unhealthy coping techniques really cause more problems in the long run and may lead to aggression or violence. So what we want to do is make sure that everybody is helping themselves first. So when you go, before COVID, when you'd hop on a plane, you'd have the flight attendant give their little speech and say that when the thing falls out of the ceiling, to give you your oxygen, put it on yourself first so you can take care of others. So this is exactly what we're talking about when we're taking care of ourselves. We need to make sure that we're educating ourselves and we know what our resources are and what is going to be able to help us should we need it. We need to ask for help if we have a problem that we can't solve ourselves, and whether that's with friends or family or getting professional help. We need to get outdoors and stay connected with nature. We need to stay connected with our friends and our family and people who are important with us. And whether that is by Zoom or a simple phone call or social media and texting, or maybe creating a safe place where you can meet with distance, with protective gear, and being able to see people in person whenever possible. That's a great way to stay connected. Eating, sleeping, exercise, getting a routine that's going to allow us to do that in a healthy way on a regular basis is really important now more than ever before. Stress reduction techniques, whether it's breathing exercises, whether it is getting an accountability partner to check in with, or somebody that you're going to walk with outdoors, finding some way to reduce your stress and doing that again on a regular basis. Doing some planning. So this is, take some planning to do our day-to-day activities. It's not as easy just to run to the store or go see a friend. So planning ahead and figuring out ways that we can do some of the things that we need to do on a day-to-day basis. And be realistic, because this is a pandemic. Everybody is experiencing distress. Everyone is feeling this disruption. So you may be feeling it, but you're not alone. Everyone is feeling this disruption, and we all need to find out ways that work for us or ways that work for our family to be able to move forward and stay healthy and stay knowledgeable about what's going on around us, so that as we move through this and hopefully come out of the pandemic, we'll be much stronger than we may have been at the beginning of the circumstances that we're experiencing. So once you're taking care of yourself, then we can also check in with our family, our coworkers, our friends. We want to check in with them on a regular basis. And maybe that's creating a Zoom meeting for family to get together. Maybe that's just sitting for a while with your kids at night and right before bed, and making sure that we can bring down the anxiety and address maybe some concerns that they haven't been able to verbalize. Acknowledging their stress, letting them know that a lot of people are experiencing that, and being vulnerable, letting them know that you have some of those same concerns, that we're going to figure out how we can get through this, but reassuring them that you're going to be there for them, that we're going to be here for each other, and that we're going to find ways to get through this. Giving them a little structure to their day. Studies have shown that people are waking up an average of 75 minutes later every day, because since COVID, we got to make sure that people are still keeping with some type of schedule that is conducive to the day-to-day activities that they need to take care of, whether it's work or school or other obligations that they may have. And again, making sure that we're still getting an ample amount of sleep to be able to function well during the day. Again, educating ourselves, staying up on the news, but not overloading with the news, knowing what the latest guidance is in terms of COVID and protecting ourselves, paying attention to what's going to be happening with vaccines, and knowing what resources are available to help our families and our friends. Keeping the team connected, whether that's your work team or your family team, making sure that we're trying to still eat together in the evenings, and having some of those routines or rituals that we may have as a family, trying to continue them as much as possible so there's a sense of some kind of normalcy. Encouraging our families to take care of themselves, seeking help for them or your children if they're struggling in a particular way. And by us taking care of ourselves, we can set a good example for our families and find ways to be productive again. So what we want to do is control the things that we can, take the focus off of things that we can't control. So we can control, in a sense, we can control our schedule, or blocking out time for our family to be together, or troubleshoot problems. We might want to just simplify our to-do list. There may be some things that just aren't as important right now, or we can put them off and really focus on the things that are important right now. Getting rid of unrealistic expectations. We may not be able to sign up for all those clubs and things that we used to do with our kids or with families, and just, again, prioritizing and picking out the things that are really important, and taking some of the pressure off of us on a day-to-day basis. Again, minimizing our exposure to the news, practice social distancing, use protective gear, masking, hand washing, exercising, minimizing our risk associated with contact from others. If somebody's in quarantine, make sure that we don't go see them. And these are all things that we have control over. So we want to focus on those things and take our focus off of things we can't control, like how, the virus is manifesting itself. So we want to be kinder to ourselves, more non-judgmental to ourselves and our families. We all are experiencing this disruption, and everybody is experiencing it internally in a different way. So we've got to be really good problem solvers. We need to think creatively, and we need to come up with solutions that allow some flexibility. We want a positive attitude, find the humor in certain situations, be optimistic. We will get through this. It may not be as quickly as we would like, but we're coming up with ways to creatively still stay connected and be able to get through the times when we're not able to be together. And just being really mindful about our day-to-day routine and things that we're doing in terms of food and exercise. We want to communicate. So we want to clarify and express our emotions and the emotions of our family and our loved ones. We want to make sure that we're not so emotionally charged, but that our discussions and communications are more meaningful. We don't want to make assumptions about others. We don't want to just assume that our family is doing okay. Have those difficult conversations. Ask open-ended questions and try to find ways to get our kids to open up, or our families to open up about what's going on with them. And maybe there is a way that you could help. We want to be intentional about this. Share your experience and also ask questions about their experience. And maybe you'll uncover some nuggets that are, positive things that we can share with others, or there may be some things that you uncover that you may realize that need a little bit of attention from perhaps a professional. So we want to be intentional ourselves and our families about our food intake. Again, the quality of the food and the scheduling of our food, making sure that we're eating on a regular basis. We want to be especially mindful of sugar, alcohol, and caffeine, which can affect us. Mindful of exercise, balance in life activities, being able to get away from Zoom or the computer when we can, get outside, connect with nature, tracking goals and setting goals, and tracking things that are going on with you. It might be journaling, it might be monitoring or tracking concerns that you see and reassessing that. And maybe this is where we start seeing patterns where we may need to start getting some support from others. So ways to deal with stress and anxiety in a healthy way. It's different for everybody. So we want to think about ways that we can get rid of those hormones that we talk about that just sit inside of our bodies, and we need to get them out of our bodies in a healthy way. And it may be deep breathing or meditation or guided imagery. There's lots of things that you can find on Google or YouTube, and just find some free apps or free guided imagery, meditation things that you can pull up and just try to work through them. Sometimes it's difficult if you haven't done that before to find a way to quiet ourselves for a long period of time, but just starting for short periods, 5 or 10 minutes at a time, and gradually increasing. This is another way. Just kind of finding the humor is stretching and moving our bodies and meditating and finding ways like yoga or other hobbies. This is a great time to find some new hobbies. We might like our old hobbies, like playing an instrument or gardening or doing things around the house or cooking, but there may be some things that you maybe thought you'd like to do but never had the opportunity. This is a great time to find that. You may be able to find some online free courses, or there may be some things that you could pay for and go on Zoom and have a cooking class or a cooking demo, learning a new language, learning an instrument, joining some virtual clubs, maybe pick up some gardening and things like that, crafts, hobbies that are indoors, especially as we go into the winter, even puzzles or books or reading about something new or about travel. These are ways that we can stimulate our brain and maintain our cognition, because we're not out and about doing all these things that we used to do. that you may be limiting your cognition. And finding these new ways to engage yourself are ways that you can exercise your brain, and it's great to do different things that exercise different parts of your brain. Just like you need to exercise different parts of your body, whether it's weightlifting or cardio or, you know, pumping the arms or pumping the legs, we need to exercise different parts of our body. The same is true for our brain. So we need to exercise different parts of our brain by doing a variety of different things and not just the same thing over and over. We want to also find ways to have fun, and it's connecting with friends or games or doing something online or in person. Again, in a safe way, but coming up with different ways that we can do that. Coming up with games that you can do with your kids. And it may be something you can pull up on the screen, and trivia that you can do on your cell phone that projects onto the screen. There's lots of creative technologies out there that allow us to do things that might be fun. Heading into the holidays, our rituals and traditions, they're very important to us as families and who we are. And it may be different this year. We may not be able to have those large gatherings or indoor gatherings where we stayed connected. So we need to think creatively of how we can stay connected, whether it's smaller groups or open houses where people kind of transition throughout the day, or maybe it's doing it online through Zoom or other platforms. But really important to kind of continue the rituals or traditions that are really important to our family, whether it's our faith-based things that we used to do, or things with our families that was important, like baking cookies or things like that. So sending out cards and staying connected. Maybe this year is the chance that we can get back to writing some letters to friends through Christmas cards or holiday cards, just to be able to stay connected with people who maybe we've lost contact with. So walking and exercise and enjoying nature, getting out and about, maybe finding an accountability partner that we can go. And this picture was taken prior to COVID, so they're a little bit close right now with COVID, or they should be maybe wearing masks, but getting out and walking far enough apart that you're not going to be that close together, but you can still have those conversations and engaging conversations that a lot of us are missing today. But having that accountability partner is maybe somebody that's going to be encouraging to you to get out, and again, avoiding that isolation, which can lead to depression. And we want to really be mindful about depression and how there is an increase with that, especially with the ways that we've had to be limited. Maybe creating lunch or coffee outdoors with a friend. Seek support around you. There's lots of things that are available to you. Professional organizations and professionals who can help you, and telehealth and different ways that we can stay connected with people who have mental health expertise of a variety of areas. Music is another way, a great way that people can stay connected with their past, but also allows them to relax and be mindful. Baroque music in particular is a way that exercises both the left and the right side of the brain, and it's a very good way for the human body to relax. So listening to Baroque music and doing some deep breathing exercises are what experts say that are very helpful to keep people's stress and anxiety down, and it's a healthy way to get rid of those hormones that may be building up in our system. Art is a great way as an outlet to be able to learn something new, or doodling or journaling, reading. These are all ways, again, that we can have an outlet for our stress and anxiety in a healthy way. Ways to fit it into our life, and I know we all are struggling with that work-life balance. How do we fit it all in? But again, reducing stress, minimizing or eliminating things that just aren't important right at this point in time, and scheduling a set time to practice some of these on a daily basis, whether it's early in the morning when it's quiet and that's the calm before your storm of the day, or maybe it's in the evening when things start winding down, or maybe blocking out an hour in your day that might be your lunch hour, but it gives you time to kind of regroup and refresh and be able to kind of plan for your afternoon and when things start getting active again. Avoid practicing when you're sleepy. When you're sleepy, you probably are lacking sleep. So in the evenings, if you're really tired and it's difficult for you to focus on some type of meditation, then maybe that's the time where you just go to bed a little bit early that day to be able to catch up on sleep and be in a better position to go about your day the next day. Expect ups and downs. You may have good days, you may have bad days. Give yourself that forgiveness and allow yourself to get back on track. Again, just having the expectation that you're gonna have some bad days, and that's okay. It's normal, and everybody has these days, and it's okay to get through it. Surround yourself with a supportive network to make this happen. If you're having a down day, maybe your spouse can pick up with the activities with the kids, or they can cook dinner, but be able to have that supportive network that if you're having a day that's just a little bit off, maybe somebody else can fill in, and you're able to do that on a day that you're having a good day and they may not. So we've talked about these ways to stay connected, phone, Zoom or other platforms, FaceTime, Instagram, all those things that we have to communicate with others. One thing that we've found here at the option group is the GrandPad, which is a tablet that has very, very simple technology, which is great for older people who may not be technologically savvy, and allows them to stay connected and have those virtual calls or online games or things that they can collaborate with family if they're not able to see their family in person. Free online courses, virtual activities. Some people are going back to the good old pen pal and being able to find somebody who may be isolated and just encourage them, or reconnecting with somebody from their past that they lost contact with, or having a phone buddy, just somebody that you can touch base with whenever you need to, or setting it on a regular schedule. So you know that if you're feeling down today, you know at 5 o'clock this evening, you're gonna have that phone call with your friend who's really supportive. And again, we talked about learning something new to engage your brain, and it's a healthy way to distract and a healthy outlet. So we want to keep in mind that our brain health is really important right now. And we kind of have talked about all of these things, but really nutrition, meditation, exercise, and educating ourselves, and having some downtime to do some fun things like puzzles or building models or doing some type of manipulative that engages your brain in a number of different ways. So here are some resources that I'm going to share with everybody. I have given Jeff the list, and he's able to share that. I believe it's actually attached here. You can download it from the platform that we're on. But the Mental Health Association, there's lots of phone numbers and lots of resources here in the state of Maryland that can help you for information, education, resources. They may be able to link you with professionals who can help you with a particular situation. I'd like to bring your attention to the suicide hotline here in Maryland, 800-422-0009. So if you ever have concern for yourself or someone else, that is a great place to call and get help in a crisis. There's a free counseling hotline for Maryland, and a community crisis hotline, which is a 24/7 hotline if you just need someone to talk to, or a friend needs someone to talk to. Please share this resource list with your family, with your church or synagogue. Help it, share it with your work or other people that you collaborate with, because it's a great resource to look into. For folks who are struggling with substance abuse or alcohol or domestic violence, here are some great places to connect with, and I encourage you to reach out and share this information with your friends or family or others who may be struggling with these areas. For the aging population, Maryland Department has an aging senior call check, and they will check in on an aging person who's isolated just to see how they are and check on their well-being. There's a Safe Elder program for seniors who may be experiencing domestic abuse or maybe needing some help. And there's the Alzheimer's Association hotline, which is a 24/7 hotline for families who are struggling with caring for somebody who may have Alzheimer's or dementia. Shepherd Pratt here in Baltimore has a virtual walk-in clinic, which is by telehealth, as well as Counterpoint, and they focus on the aging population, but they also have telehealth available for psychiatric needs. There's some online platforms for counseling, and you can find a counselor, be matched with a counselor who specializes in an area you may be struggling with. And there are lots of online support groups through some of these, and they can link you. Maryland 211 will help with human services, housing, food, unemployment, utilities, and children or of aging parents. The Maryland Access Point, there's a main phone number, but they each have a branch in each county. And it's a single point of entry for help with aging and disability resources and other resources that are at the county or state level. The mobile crisis team, each county has that. You can Google it for your county. And the mobile crisis team is a psychologist and a police officer who may need to intervene at the time of a crisis. There's lots of help and resources through your local school system, whether it's the public school system or if you have a private school that your child attends. There are lots of resources that you should reach out to through them, through the school counselor. And there's lots of help through your faith community. So again, don't hesitate to reach out to any of these things. And here's my information. Don't hesitate to reach out to us as well. There's lots of resources available for you. But I want to thank you for your time today. And I encourage you to keep going, stay connected to others, seek help when you need it, and look for the silver lining, which is out there for all of us in ways that we still have yet to discover. So thank you, Jeff, for having me today, and I really appreciate your time. Thank you.
Well, thank you so much, Ellen. Just a wonderful presentation. Lots of great information. And I personally feel uplifted and more hopeful after listening to everything that you had to say. And I hope that our listeners and viewers feel the same way. I actually have a question, if you don't mind.
Sure.
And maybe you can answer it or not. So I keep hearing a lot of people say, maybe perhaps a little bit in jest, but also on a serious note, you know, once we get through 2020, everything's going to be different and my life is going to be different. And I'm sure you may have heard this as well. So, you know, I found the statistics and information that you shared, you know, very interesting and very useful as well. But, you know, if COVID is still an issue, an ongoing issue in many people's lives and viewpoints going into the new year, as it very well, you know, may be, you know, do you feel stress levels and anxiety levels will continue to rise, or do you think that people will start to find and use these many ways to, you know, cope with them and issues that they're facing, you know, as we continue to face this, you know, battle and pandemic that we're currently all dealing with?
Yeah, we, you know, there's no doubt that we all have new challenges every day based on this. And we're going to be seeing that ripple effect that we talked about earlier, where it's going to be impacting people in terms of mental health, in terms of finances, and in terms of stability in their lives in a lot of ways. But we have seen a little bit already that people are starting to settle into what they call that new normal, even though it really is not normal. They're finding we're resilient people. We're finding ways to adapt and adopt new ways of handling things that come across our plate. So it may be, you know, I think that in technology, I've heard that we've moved forward as much as 5 years in adopting technology
Okay.
5 years faster than we would have otherwise. And that's probably true. I think all of us have spent more time on these virtual platforms than we have before, but we're able to accomplish a lot of the things that we needed to accomplish that we used to in person, but we just can't right now. So we're still able to function and still able to continue forward with a lot of things that we need to do, which really is, people need a purpose. So this is allowing us to continue to move forward with our purpose and stay connected with people, continue to work if we can. So we are resilient. We will continue to find ways to be able to stay connected with people, but also do the things that we wanted to do and realize our goals. I mean, I think we have all pushed pause on a lot of things that we wanted to do and just can't right now. You know, the joke that I heard is that the worst purchase that we could have made of 2019 was a 2020 planner. And we kind of have to look at it and see the humor in things. And so, you know, I hope that we can all buy a 2021 planner and at least start putting some things on that. And I think that going forward, we will be able to, a lot of it may be tied to a vaccine, and a lot of it may be tied to weather and other elements that allow us sometimes to do the things we need to do, but other times preclude us from doing that. So we just have to be flexible, see the humor, be creative with some solutions. And again, there's hope that things will get better over time, and hopefully it'll be shorter rather than longer.
Well, very well said. Well, I saw the word intentional in your presentation there, and everything that we do here at the firm, we try to be intentional in what we do and have a purpose. And we've certainly tried to maintain that here throughout the year. We've had to pivot, which I hear that word a lot, and you know, still try to maintain our mission and values and purpose every day. But it certainly has been a year of adjustment as well, and but always keeping our eyes forward and you know, working on, you know, being collaborative, compassionate, and focusing on client education and taking care of our clients every single day here at the firm. And whatever 2021 brings, we will be ready for it and keep moving forward. So Ellen, we want to thank you for a great presentation, and I think we'll give you a virtual hand, as we always like to do. Please reach out to Ellen as a resource. You have her contact information. I'm sure she'll gladly answer any questions and be available for your family's needs in any way possible. You know, I'm privileged, as we are here at the firm, to know Ellen. Consider her extremely high level, as you can, you know, probably see from this presentation. She is truly an advocate for individual and families of all types, and we need more people like Ellen in the world today. So we'd like to thank you for being part of our 2020 client event on-demand video series, and hope you enjoy our other content we have available. Have a wonderful day, everyone.